Let's talk about the number one reason people end up needing a total hip replacement and what you can do about it before it gets worse. Osteoarthritis, or OA, is the most common reason people need a hip replacement. Millions of adults worldwide, mostly over the age of 50, begin experiencing pain, achiness, stiffness, and a loss of mobility due to cartilage breakdown in their hip joint. But osteoarthritis isn't just about wear and tear. It's also influenced by a number of factors such as genetics, past injuries, and body mechanics. Hi, I'm Lorna Kleidman. I'm an 8-time world champion athlete, personal trainer, and the creator of Hip Ease. I've had both my hips replaced, and I want to help you to prepare for and recover from hip replacement so you can get back to the activities that you love. So what does OA feel like in the hip? It's usually a slow, nagging progression. It doesn't happen all of a sudden. In the morning, you might feel stiffness or achiness that gradually eases as you move around. There may be pain or discomfort when walking, especially going up or down stairs, achiness after sitting for a while, and usually after you've been standing, there's relief when you sit down again. And the discomfort is usually found in the groin, but it can also be in your thigh, your butt muscles, or even in your knee, which ends up leading to compensatory movement patterns. Other signs are limping, which I had without even realizing it, trouble balancing on that leg, and weakness when trying to climb stairs or squat, and decreased ranges of motion compared to your other side. If you're starting to notice any of those symptoms, OA may be the issue. So, should you get an x-ray? You can, but just know that oftentimes people have symptoms or discomfort, but the x-ray doesn't show anything abnormal. The opposite is also true. The x-ray may show degeneration, but the person doesn't have any symptoms. Oftentimes, a clinical exam with your doctor may be enough. But before you consider surgery, you need to know that the first treatment approach is exercise, but not random movement. You want targeted strength, mobility, and stability work designed to support your hip joint and reduce your pain before you have a hip replacement. This is exactly what I did throughout both my hip experiences. I maintained my strength training routine, reduced the ranges of motion as necessary for things like squats, deadlifts, lunges, but I kept my legs and hips as strong as I could, and this made all the difference to keep me pain-free and then have an easier recovery after the surgery. Just know that you're not alone in this process. If you have any questions, post them below. And if you like this video, please subscribe, share, and stay tuned for more guidance with your hip replacement journey.